like to introduce my 6 months progress. By the way, I joined the PhD program in last November and started my project at the end of January, so it would be my 3 months progress report meeting, and I don't have any data to present, sorry. My name is Gefu. I'm a PhD student from CTM. My supervisor is Peter and Andrea. SD and Qian Xinyi are my SMS. Daniel is our group, is a statistician in our group. As I mentioned, I participated in the program at the end of January, and my vision is improving the prognosis of acute pancreatitis patients by investigating less common etiologies. My mission is explore the effects of virus infection in GI system. Now, I have 2 specific goals to achieve my mission. The first one is about concomitant virus infection and acute pancreatitis. The second one is about serum lipids and COVID-19. The following is my introduction of the first project, investigating the effects of concomitant virus infections on clinical outcome in acute pancreatitis. It would be a meta-analysis, and Petrina is my co-investigator. The incidence of acute pancreatitis has been increasing for 10 years. Most episodes of acute pancreatitis are mild, but 20% of the patients develop to severe and have a much higher mortality. Most deaths of severe acute pancreatitis arose from multiple organ dysfunction secondary to infected pancreatic necrosis. In the etiology of the acute pancreatitis, virus infection is not the most common one, but cannot be ignored. Lots of kinds of acute pancreatitis can be accompanied by lots kinds of viral disease such as mumps, influenza, COVID-19, and so on. Whether or not the viral infection is the cause of the acute pancreatitis, an AP patient with a concomitant virus infection might have a worse clinical outcome. So my aim is to investigate the effects of concomitant viral infections in AP. According to the background, we would like to ask what are the effects of virus infection on the clinical outcomes in AP. We will include patient hospitalized with AP as our population, and its exposure and the comparison is with or without concomitant virus infection, and the primary outcome is mortality, and the secondary outcome is severity and complications of AP. We assume that concomitant virus infections such as HBV are associated with worse clinical outcomes in AP. Previous studies implicate that concomitant AP patients with concomitant virus need more careful pancreatitis management strategies. Then we did a systematic search based on 3 databases. We finally get around 6,000 articles after duplication removal. Now the project is on the title abstract selection, and the progress is around 60%. Let's continue with the second project, identifying the association between serum lipids and their metabolites and the outcome of COVID-19. I got this great idea from Beata. She was a PhD student, but for her personal reason, she can't continue with this project, so I'm going to push it, and it's just started. I think we are familiar with the background of epidemic of COVID-19. More than 600 million patients confirmed by COVID-19, and 6 million patients died. Once admitted by ICU, the patient will have a very high mortality. So how does SARS-CoV-2 infected us, or what is the mechanisms of the infection? In that case, we have mentioned ACE2, angiotensin converting enzyme 2 is a vital protein in many types of human cells and tissue. It regulates the important biological processes like blood pressure and inflammation. SARS-CoV-2 could recognize ACE2 as a receptor to infect the cells and disrupt the important biological processes. Adipocytes have ACE2 at receptor as SARS-CoV-2's receptor. So it seems not strange that pancreatitis or fat necrosis were found in 20 to 40% of COVID-19 full body autopsies. In the picture, as we can see, both acute pancreatitis and COVID-19 may increase the lipase activity, and it may cause a rapid lipolysis of adipose triglycerides, and the metabolites is non-esterified fatty acids, which can be toxic. Such lipid toxicity will induce the cytokine storm and finally results in severe disease both in lung and pancreas. So we came up with our clinical question: what is the association between lipid profile and the outcomes of COVID-19? Our population would be COVID-19 adult patients, and the exposure is on admission lipid profile, and the outcome is mortality. We assume that altered cholesterol, triglycerides, and unsaturated fatty acids levels contribute to the increased severity of COVID-19. And the previous studies implicated that we can use identifying altered lipid parameters as risk factors of severe COVID-19 to urge prevention and early treatment. We would like to submit the first project in August, and the second one is in September. I would like to end my presentation with the following sentence. In school and life, the most important driving force of work is the pleasure in work, the pleasure of work as a result, and the recognition of the social value of this result. Thank you for your attention.
Regarding to your first project, you mentioned the concomitant virus infection, and what of them are the most common virus infection based on your preliminary research?
Yes, hepatitis virus and HIV and SARS-CoV-2 is the most common viruses.
In your first project, you have chosen these viruses for analysis. Why hepatitis B and HIV? Why not hepatitis C? And these are causing chronic viral infection, and you choose some viral infection with acute course. Can you comment on this?
Of course, I think all kinds of hepatitis virus are related to acute pancreatitis, not only HPV. I just choose one more common.